Chat if everyone sees us. Great, great. So hello everyone. It's a pleasure to be here. I'm Sur. I'm the CEO of the Dream Doctors Medical Clown Organization, and we're happy to be with you today as part of the Humanitarian Week to highlight the work of the medical clown, professional clown who works in hospitals and in times of emergency situations. Dream Doctors is a non-profit organization that was established 20 years ago and operate today in 32 hospitals across Israel. We're medical clown. We have 100 that are integrated, fully integrated as part of the medical team in a regular basis. And our goal is to advance treatment and treat the healthy side of the patient. In addition to our work in the hospital in the last 15 years, we're involved in humanitarian mission around the globe, bringing hope with a smile to people in need. All our clowns that are trained to work in those situations are sent mostly natural disaster, working with refugees in places such Nepal, Haiti, Indonesia, the crisis of the refugees in Germany, and of course now with the Ukraine crisis, we send clowns to work as part of medical and relief delegation. This is our agenda to work as part of teams. And we do it, of course, with partners like Ministry of Foreign Affairs, IDF, Red Cross, and other organizations on the field. So what is all about medical clown? Probably people who don't know ask. So for us, medical clown is a therapist that can use clown-rich toolbox, nonverbal communication, body language, and work in a team to promote health. We saw that in the past, clowns also help to be mediators in places where language is, we have language barrier. So, nonverbal communication for the clown can help families, children to understand what is going to be with the treatment. So we see it is very important. In the last 2 months, we've been working alongside the Ukraine border, from greeting people on the border to working in shelters across the border. As you probably know, no severe injuries, and most of the need is mental health. So this is where the clowns are coming in, bringing hope to the people and to give them, strength and believing in a better future. We're happy that you are with us today here. With us is Nimrod Eisenberg, talented clown, and also leading our operation abroad in humanitarian crisis that will give you more in-depth overview about our work in humanitarian crisis. So the stage is yours, Nimrod. Thank you.
Shalom, shalom, everybody. Thank you, Tzur. Thank you for these greetings and good morning, wherever you are. My name is Nimrod, and I want to take you into a little in-depth tour into these special activities of humanitarian clowning. So let's start right off with a little bit of an exercise so that you don't just listen to what I say, but also feel it in your body, because clowning is an immersive art. It's the art that takes us into a different state of mind. We see it on stage, we see it in circuses, we see it in the street theater, but also recently in the past 20 years, we see it in hospitals, in the healthcare environment. And we see clowns being part of the medical staff all around the world. In Israel, we have an in-depth project into clowning integrated into the healthcare system. This wonderful tool, the red nose, is such a mysterious and intriguing article. We can use it in so many ways. And when we come as medical clowns, we come to use it for the better of people in need, to share, to express, and to come out of the situations that we're in on the emotional level. I want to welcome you to join me in a little bit of a head dance. Yes, right here in the Zoom meeting, just a little bit of a head dance, just to open up a little bit our body as we start this meeting. Okay, so that was the first technique of clowning, the mirror game. Working together, inviting the audience, inviting our partners to play along with us, mirroring each other and playing together as children do all the time. We as clowns take this art of adult child situation, the clown, and bring out the inner playfulness. I want to start off this session today with a presentation about clowning in humanitarian missions. So the Dream Doctors organization has been around since 2002. This is our 20th year anniversary right now. We operate clowns in hospitals all around Israel, but already as early as 2005, we started sending out clowns into humanitarian missions around the world. Israel is a country with a lot of challenges, and so we also developed a lot of many techniques for mental health recovery, for emotional support, and the medical clowns are definitely part of these efforts. Clowning is this wonderful art form. I personally started when I was in high school myself, because this red nose symbolized for me something larger about life, about the way we communicate with each other, about the way we deal with our problems. And I've always seen it as a global phenomena that brings people together. It is a humanistic art. When we put on our red nose, we're all the same. And we can see how the red nose unites humanity in so many ways. Clowns travel from country to country. They don't need the common language and culture to interact and entertain. And that's part of the secret of the clowns. They bring out our deepest humanistic points and help us communicate and connect indeed. Humor in itself, when we come to look at this phenomena of humor, we find a fascinating fact that the word humor, the word itself in the Latin environment, comes way back from Middle Age medicine. How do you say Middle Ages medicine, where the medicine was much more of an art form. There were no techniques and instruments, and they had this ability to examine the person by the humidities in their body, the black, the yellow, the red, and the white humidities. And they would see when this person was imbalanced, too much liquids coming out of parts of their body, they would say this person is not well. And we try to balance the humidity. The word humor, coming from humidity, actually represents a balanced state of health. So already in the basic concept, we are looking at the way to bring people back into a balanced state through humor. Clowns have a special kind of humor, and we see clowns all around the world, in many cultures, in past, long ago times, and also in these days, today. Clowns have a special kind of humor. They don't tell jokes. It's not about being witty or interesting or smart. It's about being simple, and it's about communicating with each other on a very, very basic level. Clowns have been associated with shamanism and tribe healers way back, way back. We see in the different cultures in Middle America and in the Far East, these characters that are funny and provocative and interesting, and they are part of the healers of the tribe. And so clowning goes way back with healing. Now, as emotional support therapists, we look at the emotional situation of our patients, of our partners. If we look at these pictures, we want to take this child on the left and transform their behavior to this child on the right. And we want to encourage and provoke emotions and inner strength in these people. We don't come to do a show for them. We come to have them do a show for us or interact together, creating this healing show. We want to make art into a process of feeling better, of coming out of where you are right now into a better place. I want to take you into a little bit more into the goals and targets of our operations today. And I'm looking at Article 31 of the United Nations Bill of Rights. And we see that the right to play was established as one of the basic human rights. We want to spread the ability of children and adults to play and live their life in a better way. We take it after the famous psychologist Donald Winnicott, who said, play is therapy in itself. He developed play therapy approach where playing, expressing emotions, in enacting situations is part of the ability of a person to overcome their emotional difficulties. And indeed, the UN has put it in their Bill of Rights. And so we really believe in the importance, the basic importance of these abilities and of how we can use clowns to change and aid in these situations. I want to share with you or immediately a short video about the activities of the Dream Doctors in
One unit has become legendary, the Israeli Medical Unit.
Police arrived here Friday night. By Saturday morning, they had set up a field hospital.
We're seeing the patients shouting and seeking for medical assistance, and there's no one to help them.
Saturday morning, I was examining a kid, and suddenly the Israeli elite commando unit security guard came and he said, 2 medical clowns waiting for you at the entrance. And they just show up and they blend in perfectly.
The medical clowns pops out. The colors are different. He's coming with a red nose, with a different music. It brings yourself, it brings the patient into a realization of something that seemed obvious, that there is another world.
This is international language, and these guys are professional clowns. And they just bond together, and you can actually perform medical procedures, putting an IV line, to put a cast, to do the infected injuries with medical clowns without sedation.
And one of my personal understanding is that the medical clowns are part of our personal treatment.
He or she or the group of clowns create what I call an island of resiliency, because around them, suddenly people who have been out of a crisis, disaster, suddenly there is a small island of laughter, play, and in that sense, they help that group to recreate what I call a sense of community.
After the mission in Nepal, I think the army did a really nice move. That medical clowns are going to be now a formal part of our team. I'm sure that in the next few years we're going to see more and more teams understanding the importance of medical clowns as part of the first responders.
Wonderful. A wonderful video that shows us the importance of clowns working together with the staff. Our clowns are not an isolated unit. we are always there to collaborate and cooperate with other units. We want to aid in therapy. So our clowns are in the procedures that are being given in field hospitals, for example, or field clinics. We help in the acts that the medical staff takes part. So if it is about treatment and healing, the clowns would be there to support, to change the ambience, to bring lightness to the environment, and in other places as well. I want to show you, take you a little bit deeper into the techniques and the different methods that we use, the way that we work out there. Our clowns have been active in so many different missions with different goals. Some of these missions were medical aid missions with clinics, field hospitals in the field. Some of them were more social aid, where we would create activities in different crisis areas where we would want the children, families, the population to come together to get stronger and feel together. And so we find many different ways how to approach these different missions. The basic concept being that clowns in themselves, back in the art of clowning, are refugees. Clowns are displaced characters who travel around the world. Think about the circus, traveling from place to place, bringing lightness, laughter, sense of community into different places as they themselves are strangers, foreigners. If we remember the father of modern clowning, Charlie Chaplin, Chaplin himself, after being having a not easy childhood himself, grew up to create this character that we know today as the wanderer, the tramp. He was wandering, his character had no name, he was wandering around his stories, his movies, and changing the environment wherever he arrived. Clowns have no past, no future. They live in the moment and they react to the people around them. We don't come with a scripted play, and we cannot rehearse for the situations that we will meet. The most important technique that we have is living the moment. This Zoom meeting right here is interesting for me because I don't see your faces. I'm used to working with people. I'm used to these situations where I cooperate and communicate. I see faces, I see reactions, and I can play along with them. That's what we do as clowns. I'm taking you here into the latest mission that we conducted. Dream Doctors has been running different missions through for over 15 years, but lately, in the past 2 months, we have sent out, I think, almost more clowns than ever. The crisis in Ukraine has become a very clear problem, refugee problem, and an emotional social problem, one that we have abilities to contribute and to change. We will see different ways that our clowns interact and operate right now, up until last week, and in the future again, on the borders of Ukraine, receiving the refugees and bringing relief to these people, to these situations. Right now, when the clowns meet the refugees, it was an amazing ability to greet them as they arrive in the safe point. When we look at crisis zones and humanitarian interventions, that's the first thing that we want to create, the safe space for the population. If it's a field hospital, if it's a refugee camp, we create an area where people can be safe and start getting the treatment that they need. Our clowns are there at the first point. For example, right here, we were working on the border pass between the Ukraine and other countries, Moldova and Poland. And right there at the first greeting point, the clowns were there. The ability to bring a change on a little bit of an artistic, colorful, joyful moment can create this surprise effect where suddenly the fact of coming to a safe place becomes clear, becomes apparent. And children have this amazing ability to play and interact even in very difficult situations. And those were the first places where we implemented the ability to bring a change in one moment and to raise the emotional joy, the inner happiness, and to affect the continuation of where these people are going to. We accompany the children, we accompany these families, we show them a different way to reach and to behave and to interact in the places that they go to. And indeed, we see the ability of adults and children to balance each other. Children need adults who are playful around them, and vice versa. Adults need children to raise their energy. And so this connection is a natural connection. It's part of the way that clowns mix the concepts of what is normal behavior and what is extraordinary behavior. That's what a clown is. It's a personality that can interact, can play, and can behave in different ways. When children and their families meet these characters, immediately there is an effect of awakening, of looking at the situation in different eyes. Clowns and the Dream Doctors project come from theater. Our clowns are artists, actors, directors, writers. They have stage experience, they have street theater experience. They know how to create moments and how to develop stories in the field. Our clowns are there right now, actually, in shelters, refugee shelters, where they can improvise and create activities that bring children together and that bring arts and creativity to this situation itself. We in Dream Doctors believe in being there in the moment to help when it hurts, to bring our effect not after the treatment, but during the treatment. We know that we can make a difference in the way that the whole process goes when we interact in the field. And so different activities, whether it's theater, puppet theater, magic, juggling, and just playing together, have the ability to change the situation. We can do this in different countries, in different crisis events, because clowning is a non-verbal art. The basic concept of clowning is about body language, facial expression, sounds, voices, and different tricks that we can use. And we don't need the language to communicate. In fact, it's almost an advantage for us when we meet children from different cultures, and to be able to play and understand and communicate without words takes a little bit out of the equation the apparent questions. What has happened? Where? Why? Who is there? What was lost? What are we looking at to the future? Clowns are there at the moment, interacting in a very, very basic way that overcomes these questions. These questions have a place with other therapists, and we collaborate with them. If we're working with a team of emotional aides, psychologists, social workers, we would consult with them. Where are these children coming from? What are their needs right now? How can we address these needs in play, in games? And so we find the way to reach the depth of the needs of these people without words, without talking about it, without passing information, but with communicating in a different way. Clowns have a clear objective, a challenge to restore the inner strength of the children that we work with. So we would create games and situations that bring out these needs using psychodrama and using theater games. We would bring these situations where children feel physically and clearly together, where they um, regroup on their emotional needs and regain trust of the people around them. A clown, in many ways, is a stranger to these people. A stranger, not only just by the fact that we don't know each other, but also by the fact I behave differently. I maybe wear different clothes. I make different sounds. I am someone from the outside. And when we can create trust and friendship between us and someone that we don't know, that's part of restoring our confidence in other people, or restoring our trust in the people that come to help us, and raising the level of resilience and self-healing, self-support that these children need so much. Let's see another beautiful moment from the field on the border of Ukraine just a few weeks ago. So here we have a clown musician. So clowns use different arts. It's a very versatile and flexible art form. We gather different artists. We work on, we learn and develop different techniques to use arts in the aid of these children, of the people around us. And so a musician who would normally play a concert or a song or play for the children, here uses the art that he has to have the children interact and play with them. The basic concept is that we have the ability to share and give children the feeling of trust, the feeling that they can produce themselves. They can entertain us, they can interact with us, and they can develop together something new, something fresh. Music is a wonderful art form, and what we need is a very simple music here. We can use simple arts to help other people create art, and see the way that arts in therapy are not just a form of therapy for professionals, but actually a form of communication when we meet people in need. Basic concept and a basic technique that we use is just playfulness. Playfulness is a word that comes from a term that comes from psychology in the research of behavior as serious behavior, normal behavior, abnormal behavior. We take playfulness as a research tool. We start to play and we see the responses that we get. As we develop the ability to interact and develop the reactions in a playful manner, we both are able to assess the position of the person in front of us, a person that is not responding, a person that is not in the moment, that doesn't want to play with us right now in any form, is obviously right now in a lower communicative state, and that will help us assess the situation and see further on what is it that we want to bring out from them. So it starts as an assessment tool for us to see who this person is, where is he right now. Then it moves into being an active tool of bringing them out of that place into a new communicative, interactive approach. So we start to play, we invite reaction, and just in a ping pong game, we would invite and provoke an idea, receive a response, play with it, and give it back. And when we look at this concept of playfulness, suddenly it becomes clear. All of you, all of us, we know these situations in daily life as well. When we don't feel well, when we are, when it's not a good day, we don't want to play with each other. We don't want to make jokes, and we don't want to react in an emotional state. As medical clowns, our basic language is the emotional language. Clowns are emotional characters. Clowns are happy, sad, afraid, angry, anxious, hopeful, loving, right? There's a whole range of emotions that clowns express all the time, by the way, just as children do every day, all day long. This fact of living in this emotional communication level is part of the healing effect of clowning. Clowning comes to address the post-traumatic appearances, and part of post-trauma is emotional closure. We see this all the time. We work in hospitals, and we see this effect of people in a difficult situation closing their emotions, not reacting, not responding, not expressing how they feel, whether it is hope and strength and positive emotions, or fear and anger and negative emotions. People tend to close up, and we know that when this closure happens, then the ability to heal from these situations diminishes. We have less ability to change these situations. Clowns address this point exactly, and when they play with emotions, they bring an interesting effect. We can laugh from joy and laughter, but we can also laugh from sadness or from fear or from anger. Just imagine a clown addressing children in a situation in the crisis zone, and playing with them through feelings of fear, closure, anger, difficult feelings, bringing out laughter and joy, and bridging over these two sides of our emotional state. And so taking a negative emotion and bringing out a positive response. And when we are able to do that, we're establishing this healing connection where the situation is not easy and we cannot change it, but we can change the way that we feel about it, and we can play with our emotions and bring change to that situation. By the way, at this point, I would usually play an emotional game with you. We would play a little bit with our emotions, expressing different levels of emotion and different emotions. And then we would look at how we felt about it. What did it bring up? And we see through our research and through our activities that out of playing emotions, there is a beautiful phenomena of feeling control over our emotions. We have the ability to change a little bit, to control these emotions, and not just to be under them, but also to use them, and to use them for the best, to use them for the better. We see a wonderful way of changing the way that you feel, even if you cannot change the situation. I want to take you into a few more minutes of the beautiful activities our clowns are doing on the Ukraine borders. Just playing with children and bringing smiles to these children. And of course, you can imagine, to their parents, to their mothers, to the families around them who want nothing else than seeing these children laugh and play again. What we saw right now was a game with children. Children who are in a difficult situation. And clowning has a lot to offer exactly in these situations, because it's not just about laughter. Our objective, our goal is to bring joy and happiness. But of course, when we come to these difficult crisis zones, we know that the joy is not there. There's no reason for it. So the first step that we would do is not to force laughter and joy artificially from the outside, but actually go into the situation, the emotional state of the people that we meet. Clowns bond and create friendship. They are there as a symbol of the ability to react differently to the situation. And they would start off with just being together with the people around us, establishing trust and establishing cooperation where we are just there together. We are there as emotional support. Our goal is not to bring an artificial laughter, but to bring from the outside, but to bring from the inside a new natural strength. And a result of it would be laughing and joy. We see our clowns in serious situations. And if you think about the character of clowns, they already have this ability. All of us have seen sad clowns, clowns in difficult situations. Clowns are exactly these characters that can identify with difficult moments, go into these places, and in an emotional interaction, find a way to come out of them and to bring a change. Clowning is about bonding. It's about seeing the resemblance of human beings, of people all around us, seeing how we are all similar, we are all facing similar difficulties in our lives, and finding together ways to come out of them. We spoke a little bit about non-verbal communication. We actually go into non-vocal communication. Clowns can be very silent. The art of pantomime tells us that we can tell so many stories and relate to each other without words at all. And we want to bring to areas who are affected with the crisis a new approach into communication, an approach that sees the energetic level of the people that we meet and meet them there without words, without trying to change the situation, communicating, but in playing and in silence. Our clowns have extensive training in therapy, in arts, in many ways, and their ability to bring a personal contact to the people that we meet is part of the way that we want to affect. We want to make people feel that they count, feel their value again. We want to bring personal contact to these places where people are in mass and they have this feeling of being under uh, a trauma, a common trauma, but they are special, and we bring out again these feelings. This effect tends to go on from person to person. When we light the light in one person, they would go on and bring it to other people. And part of our technique is to find these small moments of being personal and attaching to one family, to one person, giving them the attention, giving them the specialty in this situation, and moving on and bringing it to different places. We know that playing and bringing a change is a therapeutic effect in itself. We make them laugh, we make them interact, we bring more and more color and activities to what they do, and this effect in itself brings change. For clowns, all people are children in some way. What is the definition of clown? A little bit, it is an adult that behaves like a child, right? They wear colorful clothes. Sometimes these clothes are too big for them. They talk in funny voices. They move in a different way. Clowns have the ability to bridge between different age groups and different age behavior, and bring out the inner child in every person, and perhaps also let these children feel more adults in front of a clown, because maybe they understand better than the clown, or they can teach the clown, show the clown, lead the clown. And so we come to balance these concepts of age groups. For us, everybody is a child. We don't only work with the people affected by the crisis. As you can see in these pictures, working with the medical staff, with the social staff, with the teams that are in the field is definitely part of our mission. Every EMT, every field hospital knows that the burnout effect and the emotional strain on the staff in the field can be huge. And there are many ways to address it. Clowns are a wonderful tool to bring change in the field, on the spot, in the behavior during the missions, because we represent this concept and we give it out generously to the people around us. We play together. We conduct meetings. So we have games and techniques that we do with the staff in the field. We play along with them during the day in different procedures, in different activities, and we want the helpers and the staff members of emergency missions to find the inner strength and the ability to cope with what they're going through in the field. Clowning is for everybody. And when we play around with everybody around us, the clown as the specialist or the expert in the specializing staff team can bring this change into the whole team. Our clowns are always part of the mission, part of the team and the staff. We are not an outside unit, and that's how we can bring the change and effect to the whole unit. In our clown team in the Israeli field hospital, this was stated as one of the goals of clowning, to be part and to bring change to the staff themselves. One of the techniques, beautiful techniques that we found, was to have these the staff interact with their own children and families back home through the clowns. And obviously, many of these people are family parents and family people. And when we can intermediate the situation to their children back home, this brings a change to their whole emotional structure, because they have their support from home, from their children and from the families in a more colorful and strong way. And it's just another beautiful way that we found to make a difference. Clowning is symbolic. I have a few more minutes, and I want to show you just a few more images and stories from the latest mission in Ukraine. Clowns are there to symbolize the ability to overcome our emotional stress and the emotional challenges that we go through. And many times they would just assist. In this picture, we see a lady that has finally came out of Ukraine into Poland, into the refugee aid system. And our clown, after having played music and singing to her, realized that what she needed was a helping hand. And so he took the suitcase and he helped her cross the border, cross it into safety. In that act, not only is it a physical, clear help in the field, clearly helping her just to go through that moment, but he also brings to everybody around them this notion that we're all in this together, and that even clowns, colorful characters, eccentric characters are part of the aid, are part of healing. I want to show you a few clips from Kishinev. This is Leah Weiss, our clown, working with the children in a refugee shelter. Hundreds of children all together in this uncertain situation, and the clown is able to bring a change. Challenge and success in thanks to the children in one movement. Let's see another one of these beautiful moments. They say laughter is the best medicine. We say laughter is the best way to cope with problems and to take medicine. We use laughter to bring people together and to bring a change into the process of healing. And we're happy and proud to be part of the change. Humanitarian clowning is a developing art form, and we have been sending out missions for over 15 years, but also dealing with research. We have had a few researches conducted on the activities of humanitarian clowning, and you're all welcome to the Dream Doctors website to see the evidence-based material that highlights what are the ways, what are the techniques, and how medical clowning, humanitarian clowning can bring changes and can assist in so many ways. Let me take a look in the chat because I'm seeing a few questions and I'd love to address them. Okay, these are about the webinar. So the webinar is being recorded and will be uploaded on social media. You're all welcome, of course, to watch it and then also to write to us, to contact us, and we'll be happy to share these experiences. There's a wonderful question here about how do our clowns deal with the sad situations that they see? Is there a situation where the clowns get too emotional? So of course, clowns are human, in fact, very human, and they can be they are always affected by what they see. That's why we have a structure of support, emotional support to the team of clowns that goes out to these missions. We have different techniques that go on through the day of sharing situations, sharing emotions. Every evening, a meeting where they tell the stories, consult with each other, and share their emotions. And by doing that, helping each other to go through the whole mission. I can also say, yes, of course, sometimes you would even have to stop. Maybe find a place, have a drink of water, and regroup until you can find the strength to continue. This is not just for clowns. This is true for every team member in emergency medical teams. And I have to just say, we are at least as clowns lucky to have a lot of laughter and joy, seeing children express themselves and interact, and that is a huge support for us. We have in our humanitarian clowning missions many moments of joy, of laughter, and of a sense of community, and that's part of what helps us continue to do our job. I thank everybody that wrote in the chat. I thank you very much for your encouragement. We in Dream Doctors are proud and happy to conduct these humanitarian clown missions, and we will continue to do so. I'm going to wrap it up here. Of course, I can talk for hours because I really love my job. So I'm just invite you to join me in another little dance, and so you can just do as I do. If you're with me on the video, just mirror me and let's do this little dance, final dance together. Toda rabba, shalom. Thank you so much for being with us. And until next time, keep smiling.